Barb Biehner and Spence Broadhurst had the toughest part-time gigs in our region this year. As co-chairs of the Partnership Advisory Group, they were tasked with shepherding a 21-member group with diverse views and backgrounds through a very complex political and divisive decision on whether to sell the hospital. In the end, they delivered a unanimous recommendation to sell NHRMC to Novant Health, and they earned significant praise in how they handled the task, even from people who are still actively opposing the sale. Barb and Spence will talk today about making big decisions. They will be interviewed by Business Journal editor Vicki Janowski.
Good morning, everyone, and thanks, Barb and Spence, for joining us today. So just like we did last year for our last Power Breakfast of the year, we wanted to end up on a Q&A, like we did with Commissioners Julia Olson-Bozeman and Woody White. So you guys are in the hot seat now. So we've talked a lot about COVID-19 and its impacts and ongoing impacts on the community. Another major issue this year was that discussion about what to do with the future of New Hanover Regional, which is county-owned, and ultimately the decision to sell it to Winston-Salem-based Novant Health. So what we wanted to talk today with Barb and Spence about was this concept of a partnership advisory group, which was not required as part of the state law that governed this process, but something that came together. Mostly we wanted to talk about how do you get 21 people to agree on anything, particularly in this town. We want to talk with Spence a little bit about what happens next, since he does sit on one of the spots of this community foundation that will continue to have an impact for, as many of the people said this year, for generations potentially, so no pressure on him and the others who will serve on that. And then mostly we want to talk about smizing, which is smiling with your eyes, as these cover models now know, as Tyra Banks has taught us, and something that now that we live in the mask world is something that you have experience with as well. So we, for the Wilmington Biz magazine, this issue, we did pick Spence Broadhurst, Barb Biehner, but also Dr. Papagikos and Evelyn Bryant as a representation of this diverse group that came together. So just to start us off, Barb, maybe you could tell us, in the beginning, did you actually think that you guys would have a unanimous recommendation?
You want a one-word answer? No. No, I had no concept that we would really be able to come to a unanimous decision. I knew what we needed to do. I knew what I believed right for the future of healthcare in the region. But to take 21 people, and including my co-chair, who really came in not wanting to necessarily change the world, and come together was pretty amazing.
What about you, Spence? Did it look like in the beginning that it would be a united front on the end?
Well, I agree with Barb. Absolutely not. We didn't know that, but I'll tell you, we did have conversations early, and one of the things that we, I think, as a group committed to was that we really need to develop consensus. I don't think we ever envisioned a unanimous recommendation, but I do feel like we were all driving towards consensus, and so we were pleasantly, not pleasantly surprised, but you could, as it evolved over the year, you could see it moving in that direction as we went on.
So not just consensus about, excuse me, which entity to sell to, but I remember speaking with some of the members early in the process who had real skepticism about whether the county should even let go of this asset at all. So just taking from the part before you started discussing with the finalists, how did the conversations move that forward? What were some of the factors that kind of changed people's opinions along the way about letting go of the hospital?
Well, first, I don't think we've let go of the hospital, but I think, one thing we all agreed to up front is that our deliberations and our consideration is what is the best delivery system for healthcare for the next generation. The New Hanover Regional Medical Center has served this community so admirably and such an outstanding manner for the last 50, 55 years. But we were looking for the next 50 or next 100 years. And so all our deliberations were really started with fundamentally, we really didn't go into the weeds of the details of, do we sell the hospital? Do we partnership? Do we stay where we were, we really started talking about what does healthcare need to look like? How are we going to survive? And so many of us on the advisory group had a very steep and fast learning curve. You know, Barb had been on the Board of Trustees at the Medical Center for a number of years, and so she and some of the others had a head start. And then we had 5 physicians that obviously had their background, and then there were those of us from the community and the business world that really needed to learn a lot about the delivery of healthcare, because I think, you know, everybody in this room, I would venture to guess, and most people watching, maybe we took healthcare in some ways for granted, and the medical center for granted, and you know, if we're sick, they made us better, but we had a lot to learn about that delivery system and how it would work moving forward.
And delivery includes financing, and I think that just how to finance what we needed to do. It really started in 2017 with New Hanover Regional's Board of Trustees and their strategic planning process. And we realized we couldn't afford to do what we needed to do to deliver highest quality healthcare across the region. And that's when we really started saying, how do we change? How do we evolve? Do we stay the same? Do we become a new system? Or do we look for a partner to move forward with? And that's what eventually came around to the fact that we felt as a hospital board that we couldn't stay the same, and that System Co., which is what we fondly call it, wasn't going to do enough to get us where we needed to go to meet the needs of the region.
So you mentioned the mix of people who served, which include people from the business community, medical staff, but also community members as well. What, for you guys personally, were there things that stuck out that you learned from people from other parts of the community that you were surprised by, that kind of informed your personal opinions on it?
Well, I think where this starts, and the credit for the process and the success starts with the leadership of the county commissioners and the Board of Trustees, because without their vision and frankly backbone and willingness to ask the simple question, you know, they knew that if you asked a question, you know, what's the best delivery of healthcare, then, you know, the conversation will go, do we sell our beloved New Hanover Regional Medical Center? And as we all found out, that there was a lot of opinions about that, right? And so they had to have known that, and for them to show that leadership was just phenomenal. And I want to, you know, start with all the credit to those groups, because they really did. And then the second thing, as you mentioned, was to have the confidence to appoint 21 individual community members to lead the process. In other words, not lead it from a political manner, not lead it from a governmental perspective, not lead it from the medical center, but to lead it through the community. That took a lot of guts.
Yeah, and you didn't have to do it.
Well, they certainly didn't have to do it, and it took a lot of you know, it just took a lot of guts to do that, to turn it over to an independent group to do the due diligence and the research and make the recommendation back to them. So I think that's where it starts. That was to me the most important thing that happened, was the political wisdom to make that happen.
And I think Bill Cameron said it in our very first meeting. He said, this is probably the biggest decision that will be made in our lifetime. And that made me nervous. That's when I realized we were in trouble.
Well, that was going to be my next question. So, and Bill Cameron served as vice chair along with Dr. Pino.
Right.
What made you guys want to take this on and attach your names and your hundreds of volunteer hours this year to it?
For me, it's because I've spent my whole career in healthcare, because I really feel like, having led hospitals and been very involved in healthcare systems, and even a little stint on the for-profit side, I realized that the health of our community was more important than anything else. And for me, it was taking my knowledge and understanding of how our healthcare delivery system had to change, and how we had to go away from healthcare to health, made me really interested in being involved, and then eventually co-leading the whole process.
You know, Vicki, when this rolled out, summer a year ago, I was like everybody else. What are they talking about? Really? I mean, and so when when you're faced with something like that, you can sit on the sidelines and shoot arrows, or you can roll up your sleeves and get involved. And I think that's what the members of the advisory group did, is they wanted to get involved. And, you asked earlier about, did we see the unanimous or the consensus? I would venture to say that, the 5 trustees had the advantage of working on this for several years. And then, of course, John Gisdick and Chris Coudray were very knowledgeable on it. But I would think the rest of us, if you took a straw poll at the beginning, the rest of us would vote, we don't need to do anything. Yeah. But we all entered it with one thing, and I'm so proud. I wish all 21 could be up here with us, because I'm so proud of that group for having an open mind and letting the facts and the data and the information lead us to a recommendation. Yep.
So you mentioned that it was a recommendation. It was ultimately the county commissioners and the board of trustees for the hospital that had the votes to approve or disapprove the final decision. But I wonder whether just politically, or because you guys had done the lion's share of the research and interviews, having a unanimous backing of the PAG, did that, you think, play a role in it? Or on the flip side, if there had been disagreement amongst the members whether or not to sell, or also whether who to sell to, do you think that would have changed the outcome of the final recommendations?
Yeah, I'll let you ask the commissioners that. We'll get them up here and let them answer that. But I do think at the beginning, I think we had the conversation that a split or divided or controversial recommendation would have been a failure of our group. We just felt like if that would have been the case, a split recommendation or a recommendation didn't have consensus would have, in my opinion, been a recommendation not to do anything, right? I mean, if you can't, with a decision as big as this and as impactful to our community as this is, if we couldn't come to a consensus as a group, then I think that would have told us something. That would have told us, okay, we asked the question, the answer is no, and so yes, I think it would have had a dramatic impact. I think if we as a group would have made an 11 to 10 recommendation of something, that would have spoken volumes.
So just to recap on that recommendation, so an RFP was put out, 6 health systems came back with proposals. 3 of those health systems were deemed finalists and went through more rigorous interviews and discussions. And ultimately, Novant Health was who the PAG recommended and backed. One thing I was curious about, and so this is a very unique situation. You're negotiating a potential sale with business partners, but of a public entity. So there was a lot of closed discussions about it because of just comparing different deals, and that makes sense. But we didn't get to hear a lot. I take that back. We did get to hear a lot about why the PAG was in favor of the agreement with Novant. But I'm just a little bit more curious about what were some of those discussions, like what made Novant rise to the top of the pack? What made that proposal really turn out to be something that the whole group could stand behind?
I think any of the top 3 would have been great partners. They were committed to North Carolina. They were committed to our region. The ultimate fit, as Novant also discussed with UNC, the opportunity to come together on it, just became the fact that the culture and the understanding of what we wanted for our region was just the right answer. They really look to us to be the 3rd leg of the stool. They really want this to be a center, that it's its own total, what's the right word? Just like Winston-Salem and just like they are up in Virginia, they wanted us to be our own entity, our own delivery system. So we're not going to be absorbed and just brought into the system from that perspective. They're going to invest in this region so that we have everything we need. And I think that was the opportunity. And just on top of that, though, it was a cultural fit that every time we met with them, we realized, even our mission statements are very, very close. And it just was one of those commitments we felt very easy to make because of the people and their commitments to health equity, diversity, access, all the different pieces that are the goals of New Hanover Regional.
How did COVID-19 change up the process that you guys were doing, or the way that you were looking at long-term what the right decision would be?
Well, it made us have to change our platform, just like everybody else. And just like Dr. Jones said about Zooming, we had to learn how to meet remotely. And did I say Dr. Adams? Dr. Jones? Remotely and learn to do that. We also had to get past the skepticism of people saying, well, just stop the process because we'll wait till the pandemic is over and you can bring it back up. And we knew enough to know the pandemic wasn't just going to be over anytime soon. And we definitely had a charge from the county commissioners to continue the discussion. So a lot of people had a lot of homework. We had a lot of Zoom and GoTo and whatever else meetings. We met when we could in person, but it wasn't very often. And we continued to move forward and expected people to get their homework done before we met. So did a lot.
Was it because it's still unknown about when the pandemic when we'll move past that point? When you guys discussed whether or not to put a pin in it for a year or to take a pause, why did you decide not to?
I think that we had the momentum, we had the people, we had the staff, the county staff and the New Hanover regional staff did an incredible job getting us all the information we needed, and we felt we could continue the discussions. The nice thing is from October to March or April, when we had to stop meeting in person, we had built the relationships because we were meeting on a very regular basis. We met in large groups, we met in small groups, and so we really got to build that foundation and that trust among the members, I think, before the need to be remote really hit us as hard as it did.
Well, and you know, look, we reacted like everyone else in the world did. We stopped. We paused.
Yeah,
I mean,
we did.
it was, you know, it hit us too. And so, you know, we paused our meetings, we stopped. But Barb's right. We had so much information in front of us that it gave us the opportunity, just because we paused our meetings, you know, we could continue to work on our own, do research, follow up, do those kind of things. And you know, in the pandemic, you know, it just even more acutely exposed the challenges that our medical center was facing. I mean, we were on an island down here. Hurricanes create that. The pandemic creates that. You know, we end up on an island down here by ourselves, and it just really, you know, really emphasized how important the work we were doing. And we all felt that now was the right time. I mean, you know, and so we did pause, and we
did.
And we took our time, and then we all agreed, okay, we'll continue working through this, because we really didn't have a time frame. You know, we didn't have a target. You know, we weren't given, you need to have this recommendation done by this day. You know, we set our own, as any good organization will do, we set our own targets that we were trying to move towards. But yeah, we did pause, you know, but then we felt like, and it just, again, it felt even more acute, if that's the right term, or more important to continue to move forward, because the impact we saw that the initial COVID and even to today is having on our medical center as a standalone entity.
Yeah, our timing was good too, because the RFPs were out, and we had a lot of other education on the status quo and the system co that we were all sort of sifting through. So we were able to stop our meetings for a couple weeks, if not longer, and really be able to do our homework in that time. So
since the recommendation, since the approval, and it's being worked, the details being worked out now until closing, but what had been some of the feedback that you two personally have heard from the community after all the dust settled on it, after the decision was made?
You know, I think the community, I think the advisory group is a reflection of the community at large. You know, so many of us went into the advisory group, frankly, somewhat skeptical. And as I mentioned before, if we took a straw poll, it'd have been a pretty strong consensus. Let's just don't do anything, because we didn't fully understand what we were dealing with. And so as the advisory group had the advantage for a year to really focus on the facts, the information, the data, and then try to look forward, I think the community was starting to do the same thing. Now, we had the advantage of having it right in front of us, but I think over that year, the community learned with us, so to speak. And as we got towards the end and the information became clearer and clearer and clearer, the direction became clearer. And I think the community, it probably lagged us because we had more direct information right in front of us. But I think as it moved on, the community became much more informed. And as the community became much more informed, got much more supportive. And I think to your question, as we came to a unanimous recommendation, I think the community at large looked at it and said, that I trust these people. You know, they are a reflection of us. They've done their work, and then I think the community spent their time learning more and fully getting on board.
In the last few months, we spent a lot of time talking to groups, big and small, civic groups, business groups, you name it, because we weren't able early on to talk about some of the strategies because they were confidential and in nature, but we were able to kind of explain a lot of the process towards the ends, which I think helped people understand more how much thought and evaluation went into the process.
Okay, and let's take a couple minutes to look into the future and what happens next. I mentioned that the deal has been said to be expected to close sometime early next year or mid next year, so that's being worked on. Meanwhile, probably the most significant portion of it for the community at large to see is going to be the community foundation that came out of this. So as a county-owned hospital, about roughly $2 billion was part of the sale proceeds that Novant offered. 1.25 billion of that will go into an endowment, a community foundation. Spence, along with 4 others, have already been named on the initial board to help set that up. There'll be 6 others that will be appointed to it as well from the new hospital board. I should point out Barb, I'm sure would have been a strong contender, but is not eligible as a hospital trustee. So now that you have the background, Spence, you and the other 10 other members now become the rich aunt and uncles who just won a lottery, and you will have 120 cousins coming out of the woodwork to ask how you're going to spend this money. So my question is, have you guys discussed that part yet, or is that going to be a major point of discussion in terms of how to allocate the community foundation proceeds?
Yeah, the first thing I'd like to say, and this is one thing I learned in my short time in public office, is to be very clear about facts and opinions. So this is my opinion. But my one vote on the advisory group, we were focused on healthcare and the delivery of healthcare. I would have voted to make this decision if there were no money involved. I would have voted to partner with Novant to provide healthcare if they weren't writing a $2 billion check, excuse me. Now, for my friends at Novant, we're still expecting the $2 billion check.
He may have said that. No.
But so our decision was a healthcare decision, and that's where our focus was. We had, Barb, was it 18 points that we evaluated every RFP on, and I think maybe 2 of them even dealt with finances. The rest of it dealt with the strategic plan, delivery of healthcare, health equity, getting health. You heard Dr. Brown. I mean, it ties in and getting health to the people to keep the people from having to come to the emergency room. Just those kind of things. That's where we were focused. So when we did that total evaluation, I would have voted, and I'm going to go on a limb and say most, if not all, the advisory group would have voted to make the same decision if we didn't have a $2 billion benefit coming to us. But we do. So that's exciting. And I don't think, at least I wake up every day and have to count the commas in $2 billion. I mean, it's a lot of money. And I haven't really come total to grips with the benefit that is going to provide this community. It's overwhelmingly exciting, that's going to provide, and with the money that will come from the endowment as it's set up. So again, it's just an exciting opportunity. It is going to be an endowment in that, it's designed to never touch the principal, the $1.25 billion. It is designed to spend on an annual basis up to a certain amount of the growth and dividends off of that, which makes it a perpetual fund, and depending on how it's invested and the success, you're talking potentially 30, 40, 50 $1 million a year, forever, and how it's going to be done. So I personally feel an enormous responsibility. And I say that in a positive way. It's not a burden. It's an enormous responsibility. I think all the other members will do and will feel the same way. It will be it will be a lot of work for this endowment board, and I think the ones that have been chosen and will be announced will be up to the job. I think everybody recognizes the opportunity here.
Yeah, I think we've been saying this, 1.2 billion and covering it in stories, obviously all year for the Business Journal, but we've been saying it so much it almost in a weird way loses the meaning of it. But something that's striking is when you look at the size of this endowment, how it's intended to be set up compared with other entities of the same size, even obviously it's going to be the largest nonprofit in our area, but just compared to the Duke Endowment in the state or even in other states. Can you give us kind of that sense of scale? Not
just the size, but when you bring it to the scale of the geographical area we are impacting, it just makes it just phenomenal. The Duke Endowment does so much phenomenal work, but they do it all over, right? We are focused on New Hanover County. That's our responsibility. And so this is, we're being told, and I don't know how to measure these things because, as you mentioned, we've gotten plenty of phone calls already about people that are really kindly volunteering to help us. But we're learning a lot already on the endowment side. And one of the things we've learned is this is one of the largest endowments of its nature in the country. You don't compare it to the Ivy League, Yale, Harvard, but of endowments of this nature, it's one of the largest in the country, and it is designed to serve, one of the smallest counties. I think maybe the smallest geographical county in the state, or one of them. And so when you do it per capita, you take that $1.25 billion and do it per capita in New Hanover County, and start thinking about the opportunity that our county commissioners and the hospital trustees have given us in this. I haven't got my brain wrapped around it. I don't think the community has, and it's going to take us some time. Once this closes, just for the community at large, once it closes, the money will need to be invested. There'll be a period of time, and so it'll be, months and years, or a year or so before there are opportunities to be able to start investing in the community. But we'll start the conversations, day one.
In the bylaws setting it up, it did mention some specific areas where the proceeds would be spent on, and that ranges though widely from health and wellness, health equity, to education, K through 12, teacher scholarships are mentioned as examples, 911 system. So just a range of very different needs. And I know that it's not this far down the process, and you don't have the whole board together yet. So I guess I just ask you of your opinion again, and not the process. How do you go about determining where the greatest needs are or the greatest impact for this money?
Yeah, our first responsibility is to set up the endowment with a structure that will last through time. That's what our first responsibility is, because we're starting from scratch. So we'll set up an endowment with bylaws and structure and policies, procedures that will last the test of time, right? Because board members are going to come and go. Will be appointed, and new board members will be appointed over time. So that's our first responsibility. And the money that's coming was, in my opinion, earned by New Hanover Regional Medical Center. I mean, it's New Hanover County's taxpayers' money, because the entity is owned by the county, right, and by the government and the government of the people. But the value was created by John Gisdick, Phil Brown, the rest of the team, and their predecessors over the years that have created this. So those guidelines those targets, as you mentioned, really get back to what Dr. Brown was saying earlier. The social determinants of health. Not just treating the symptoms. What can we do to cure the disease, right? I mean, we never have enough money to do what we need to have. Oh, now we've got money. So how do we set ourselves up because there's so many great nonprofits and governmental entities that are doing good things in the community. We need to layer on top of that and go to a whole nother level of thinking, how can we as a community invest this money in a manner that really goes to the determinants? What's causing these problems? Why are people, as Phil said, why is our area 55th in the state from a health measure? That's unacceptable. We're better than that. So how do we take this money and go to the root causes? And it can go from education to law enforcement to housing to mental health, opioid crisis. This all these things. And so we'll start with a foundation and then work from there. But your question's a good one that doesn't have an answer to it. But we'll start with the foundation and we will work to it. And again, in some conversations, this is a community conversation. This is not a conversation with 11 board members. We don't have the answers. We are charged with the responsibility of setting this up and going to this community, doing needs assessments, going into what really has got to be done to cure the disease, not treat the symptom. And so this will be an engaging process, a perpetual engaging process, because this will go on. We've been given the blessing of this financing and this opportunity to be perpetual for the rest of time, actually.
All right, I have about 100 other questions, but in the interest of time, you guys will just have to wait to read about those answers in the Business Journal in the coming months and year ahead. So I'm just going to wrap up on this, and if you guys could both share just one thing that was something you really learned from this process this year, just personally what you got out of it.
I would say one thing I got out of it. I think the experience of working towards the consensus and working with a great group of people, but I learned a lot about the politics and how politics played into this. That's why I feel Spence and I work so well together, because he really could help me understand some of the pieces that fit together, because my focus was really more on the hospital and the future from a health perspective than it was that. But I would say that's probably my biggest takeaway, and my biggest reward for that was I made sure Spence had plenty of peanut M&Ms to get through the process so we could keep him under control. So
I'm addicted to them. Mine was an educational process of the health delivery, and especially as it gets to health equity and the determinants of what the health problems are. I am so impressed with John Gisdick and the entire New Hanover Regional Medical Center and what they are doing, but more importantly, the vision that they and the trustees have put out there for this community that led to the questions. They put this strategic plan, this vision that said 55th out of the state's not going to cut it. We are better than that. We're going to get better. Here's how we're going to do it. But then that forced the question. Okay, here's what needs to be done. The resources aren't there, the finances aren't there, the reach isn't there. We can't reach out in New Hanover County into the areas that we owe it to do that. And so understanding that and following their guidance and leadership and being able to be a part of delivering a recommendation that I'm convinced, 100% convinced, is the right thing to do for this community, for healthcare, for the next generation.
we started as one of the top 3 county-owned hospitals in the country. The #1 hospital as far as not having financial support from the county, to then turning that around to give a $1.25 billion community foundation to help the county. So I feel like it really came a long way through that process.
Okay, and again, a story that we'll continue to cover into 2021. So thank you very much for joining us, Spence Broadhurst and Barb Biehner.
Thanks, Vicki. Appreciate it. Yay. Good.
I want to thank all of our speakers that came today for our most intriguing talk. As always, we'll give our speakers gifts for waking up this early and coming to us. You guys all get the commemorative 2020. Yes. Actually, we have our new Power Breakfast tumblers for our speaker gifts this time, bringing the power to breakfast. We look forward to, whether it's online or in person at some point in the future next year, seeing you again for our series in 2021. And you can read all about the Partnership Advisory Group and all the speakers that we had today who are members of our Wilmington Biz 100 list this year. And when you pick up or subscribe to the Business Journal, or you can go to wilmingtonbizmagazine.com. So thank you everybody who tuned in online and for sharing your intriguing ideas this year.